Hi there. Good afternoon. This is Melisha Bailey, Love for Life Wellness. How is everyone today? I haven't been live in a long time. I've got two cameras going. So I've got my Instagram camera going here, and actually, I'm going to put my Instagram camera right here so I don't want to have to go back and forth like that. Let me see if I can turn this around. I don't know if I could do that, but we might be turning our heads doing a little bit of Instagram. Oh, it's telling me it's not live yet. Okay, perfect. Let me see if I can get this right here. Ay, ay, ay. I need this to go like this so I can do. Uh-oh. How about that way? Oh, we are having a time, aren't we? Let me see. Cancel that. All right. Well, here we just put it right here. We will put it right here. Perfect. Let's do it this way. No, this way. This is my first time doing a live on Instagram, and I'm also doing live on my Facebook page. So it is a snowy winter day, ice here in Springfield, Missouri, and I said, let's do a lunch and learn, but it was already planned. And so it's a great day to go ahead and just do it. So about a week or so ago, I put out a poll and asked for what people wanted to hear about. As a nutritional health coach, I know what I like to talk about, but I really wanted to know what other people wanted to hear about. So the poll said people wanted to hear about diabetes. Hello, hello. And so I said, well, let's just do talk about diabetes because it is a chronic health condition that affects so many people in our country. And we will go over some statistics in just a little bit. But let me introduce myself to my Instagram audience. I don't do live on Instagram too much. I do a lot of lives on Facebook and my YouTube channel, but I wanted to do something different and do live on Instagram. So if you see my head turning, I've got my other camera here, StreamYard I use, sort of like Zoom, and then Instagram. So let me introduce myself to you. My name is Melisha Bailey. I live in Springfield, Missouri, and I am a certified nutritional holistic health coach. I graduated from the Integrative Institute of Nutrition in 2017, and that was one of the greatest things that happened to me. I went to school because of my own illnesses. I was really sick with fibromyalgia, chronic pain, high blood pressure, thyroid disease. I was addicted to pain medications, and I was just a mess. And the turning point came is when I was diagnosed as pre-diabetic. And I'm like, why am I going to let what I put in my mouth kill me or continue this downward spiral of bad health? And so I went to school, I learned how to take care of myself, and then this passion came for me to want to be able to teach other people, especially women, how to take care of their bodies so we don't get sick. So for the past few years, it seems like most of the people that have come to me have issues with diabetes, or they want to lose some weight, or they have stress from dealing with their diabetes and their weight gain and all the stress that comes with it. So that is where I have put my focus on these past couple of years, is really helping people to deal with their own diabetes. I have a husband who is a diabetic, and for lots of years he didn't want to follow some of the things that I was sharing, but when his diabetes got totally out of control, he finally said enough is enough. He did a hair analysis, and we'll talk a little bit about that as well too, but he finally just said, enough is enough. I want to take care of my health. So it's been and I've taken help my sister-in-law and so many people that with their health issues. So especially with diabetes. And so this is what I do. This is what I love. And if I could help one person, that's it. So before I go further, what I'm going to share is not to diagnose or treat any illnesses. I'm going to read it. It's not intended to diagnose, treat, prevent, or cure any illnesses or disease. This is for informational and educational purposes only. If you have any of the conditions that we're talking about, please see your healthcare practitioner and so that you can get well. And so it is not intended to replace the advice of your medical professional or a licensed dietitian or nutritionist. I am not a nutritionist. I'm not a dietitian, but I am a certified health coach, and I help people get better. So this is what I do, and this is what I love. So I don't want to be before you long. If you have any questions out there, please raise your hand. Let me know that you're out there. Say hello. Give me some love. And if you got some questions, please post them in the chat, and I will try my best to acknowledge your questions so that we can help you. Okay. So let's start from the beginning. Let me turn this around. Diabetes is one of the most dangerous chronic diseases that we face. It is deadly, and I mean deadly. My husband has had many family members to die. You maybe have had some family members that have gotten sick and that possibly have died from from diabetes, and so I don't want that to happen to anybody, and this is why it is such a passion of mine. So there are a total of 37.3 million people that have diabetes in the United States. That is 11.3% of our population. That is an astronomical number. And the thing about diabetes, yes, we have genetic propensities, but most of it can be taken care of through diet, nutrition, and exercise. That's the bottom line. And so now 28.7 million people go undiagnosed or diagnosed, including 28.5 million adults that are diagnosed with diabetes. But we also have 8.5 million people that go undiagnosed. And a lot of times they ignore the symptoms, which we will talk about, and then it gets to a crisis point. And that's what happened to my husband. That's what happened to my sister-in-law and friends, is that they ignored the symptoms of diabetes. And then when it became a crisis, then they said, okay, we have to do something about it. So diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. So most of the foods that we eat are broken down into sugar, which is also called glucose, and it's released into the bloodstream. Now, when your blood sugar goes up, it signals to your pancreas to release insulin. Insulin acts like a key to letting your blood sugar into your body and into your cells as energy. And so if you're not eating the right type of foods, then your body doesn't know what to do with it. And that's when the issues happen. So if you have diabetes, your body doesn't either make enough insulin or it can't use the insulin it makes as well as it should. So as a result, too much blood sugar stays in your bloodstream, and when there isn't enough insulin or cells to stop them from responding to the insulin, that's what happens. And so over time, this can cause serious health problems, and it can cause problems such as heart disease, vision loss, and kidney disease, which we will talk about later as well too. So there isn't a cure for diabetes, but losing weight and eating healthy foods and having an active lifestyle can help. That's one of the things that helped me as I changed my diet, and I do a lot of plant-based, and I got rid of a lot of processed foods and sugar, and I started working out. So that is the key. And a lot of people, they fight and they reject that. They want to eat what they want to eat. And I know that we want to eat what we want. And the people's like, life is short. I want to eat what I want. Eat, live, and die. But that's not how God intended it. That is not how we want to live. We want to have a good quality of life. And if you have diabetes and you're not taking care of it, your quality of life is going to be seriously diminished. And and that puts a burden on you, and that puts a burden on your family. So don't do that to yourself. Don't do that to your family. Take care of it, because it's really easy to take care of. And so, taking medication as you need it and getting diabetes self-management education and support can be very effective. That's one of the reasons why I'm a health coach, because I help do that. I can help you manage your diabetes, and I give you the support that you need along with your medical professional. If you have diabetes, go to the doctor. But the goal is to eventually either decrease or lower your medication and possibly get off of all your medication. My husband is off of all his medication. Praise the Lord. He was taking insulin shots, metformin, all of it. Now, he is under his doctor's care. His doctor knows what he's doing, but praise God, I never had to take medication. And my goal is for you not to have to take medication as well. So let's talk about some of the symptoms of diabetes. If Cheryl, thank you. You said you controlled yours several years ago with diet and exercise and could no longer manage without medications. Yes, absolutely, Cheryl. Diet and exercise is the key. And who likes sweets more than I do, or people in my family? But if you have diabetes, you have blood sugar issues or pre-diabetic, or there's another condition called fatty liver, non-alcoholic fatty liver disease, which comes from having too much sugar in your diet. So if you can control it with exercise and diet, that's going to be best. And that is what I teach, and that's what I help people to do. So some of the symptoms of diabetes is you could be urinating a lot. That's what happened to my husband. Urinating a lot. You are very thirsty. You have just a ravenous thirst. You could be losing weight without even trying. And that's what happened to my husband. His body was like eating itself from the inside out. He's a big man, and so he was losing weight. He was getting weak. The vision was blurring. You might have numb or tingling hands or feet. You can feel so tired and lethargic. You might have very dry skin, sores that may be having a hard time to heal, or you might have more infections than usual. Those are telltale signs that you could be having some issues with your diabetes. That is your warning sign, and it's telling you need to do something, and you need to do something now. Don't wait, do it now, because you don't want your diabetes, your A1C to spike up to a 13.1, and we'll talk about A1C and what that means. So, and we'll talk about A1C. So there are risk factors associated with type 2 diabetes. Mainly type 1 diabetes is a little bit harder because those people have to be on insulin, but they really have to watch their diet. So most of the people I deal with have type 2 diabetes. And so let me clarify that. So risk factors for developing type 2 diabetes is if you have pre-diabetes. So pre-diabetes is normally an A1C, and that's your blood. The blood in your sugar is over a 6.3 or 4. That is pre-diabetes. And actually, it's about 5.4 to 6.4. That is considered pre-diabetes. So, and if you are overweight, losing 10 to 15 pounds can make a big difference. But if you're overweight and if you are morbidly obese, that is a big risk factor for diabetes. If you're 45 years or older, I think I was in my 50s when I was pre-diabetic. Unfortunately, now we have a lot of children that are getting diabetes at younger and younger age. So parents, help your children. Don't give them a bunch of stuff. I was going to say crap. Don't give your kids a bunch of crap. Teach them better eating habits early so that they don't get in their 40s and 50s and start having issues. If you have a parent or brother or sister, somebody that has diabetes, you are more genetically predisposed to diabetes. But just because you are genetically have a predisposition does not mean that you will get it. You don't have to get it. I promise you, your risk factors are higher, but you don't have to get it. And if you've had gestational diabetes, that is a big risk factor. And so you have to really take precaution. Unfortunately, African Americans, Hispanics, Latinos, Native Americans also are at a higher risk for diabetes. So, I worry about us Black folks. I'm Black. I worry about us women getting diabetes and not doing anything about it. So, you can prevent or delay type 2 diabetes with proven lifestyle changes, such as losing weight if you're overweight. I've lost over 60 pounds. I am not at my goal weight, but I'm not pre-diabetic anymore. I don't have all those symptoms. I'm not on all that medication. So yes, I have some pounds to lose, but you know what? The goal is to be healthy. That's the bottom line. Not about being skinny. Yes, we could lose some weight, but we want to be healthy. So let's talk about how diabetes is diagnosed. So anybody have any questions, needs, or concerns before I keep going? I don't want to prolong this, but I do have this handout of everything I'm talking about, and DM me if you would like it. So 2 of the most common ways to test to see if you are diabetic is an A1C test. Now, the A1C measures your average blood sugar over the past 2 or 3 months. And A1C below 5.7 is considered in the normal range. And between 5.7 and 6.4 indicates you could have pre-diabetes. And if your A1C is over 6.5 or higher, it indicates that you have diabetes. If you have those symptoms, go to your doctor, get checked. And if your A1C is between 5.7 and 6.4, you don't have to go on medication. Mine was in the pre-diabetic. I changed my diet and I did not have to go on medication. So what I'm telling you, if they say you are pre-diabetic and your doctor wants to give you medication, pause, think for a minute. Can I do this on my own? If you don't think you could do it on your own, then you might want to take medication, but it's really not that hard and you can do this. And so, and also your doctor, yeah, okay. So the next thing is they may take a fasting blood sugar, and this measures your blood sugar after an overnight fast. So the doctor may say, take a fast, if any of you that are over 40 or so, you may have to take a fasting blood sugar, a fasting blood test, and they want to see how your blood sugar is when there's no food in your system. Now, I don't have it written down here because I really wasn't going to talk about it, but the hair tissue mineral analysis will give a big indication of there are could be issues with diabetes in your body. And it's a great indicator of past diabetic issues, or if there is, or if diabetes could be coming along the road, down the pike. So the hair tissue analysis is a great tool that I use with my clients as an indicator of health, and also as an indicator of diabetes. So let's talk about prevention. So if you have pre-diabetes, losing a small amount of weight, anywhere from 10 to 15 pounds, can have a tremendous difference on if you develop full-blown type 2 diabetes. Getting regular exercise or activity can lower your risk factor, as well as developing type 2 diabetes. A small amount of weight loss, around 5 to 7% of your body weight, like I said, is just 10 to 14 pounds. And that can have a tremendous difference. And getting at least 30 minutes a day of exercise, just walking, getting that heart moving, getting that body moving has a tremendous effect. My husband, we have a bike here, and I can look at it right now. When my husband doesn't get on his bike, his blood sugar goes up. You have to move your body. You have to get some physical activity to keep your blood sugar stable. So I know people are like, I don't want to eat, or I want to eat what I want to eat, and I don't want to exercise. But I'm telling you, if you don't do it, it's going to develop into some of the complications that we will talk about in just a little bit. A lifestyle change program that's offered through health coaching, through the CDC, can help you make those changes and help you to make those changes stick. Your doctor will help you with changes too. But as a health coach, I have had so many people that have gone to the doctor. The doctor tells them, this, you have diabetes. They don't tell you exactly what to do. And that's where health coaches or me or any coach can help you to give you that guidance, share with you the foods that you need to eat, and help you to lose the weight and get control of your diabetes. One thing about the hair analysis is that it's going to tell you what type of foods that you actually need for your body, for your biochemistry, that's going to bring about better health for you. So, working with a trained coach makes this realistic and also helps you to have those lasting lifestyle changes. We will help you discover how to eat healthy foods, how to add more activity into your day. Also, stress can cause diabetes or spikes in your blood sugar. So as a coach, I'm going to help you to manage your stress, help you to stay motivated, and solve those issues that can slow progress. It's not a race. It is one step at a time, one day at a time, a little bit. And for quick, easy solutions. It's not a race, but if you make small changes, I promise you, by the time you go back to your doctor, have your next A1C, your blood sugar test, your symptoms, your A1C will be lower if you make the changes now. If you don't, your blood sugar is just going to continue to rise, and then you could get full-blown diabetes, which means that you're going to be on medications that can cause other issues, or you're going to have to take insulin, and you don't want that. With the rising cost of medical care, with not being able to get into the hospital because of the pandemic, you don't want to. Right now is not the time to play with your health. Too much is going on. So I'm giving you a warning sign. If you have pre-diabetes or diabetes, take control now, because it's hard getting those doctor's appointments. Doctor's appointments are going 2 or 3 months out. Anybody out there have been having problems getting to see your doctor? Maybe not here in Springfield so much, but in some of the bigger cities, people are having trouble getting into their doctor's offices. Or going to the emergency room because there's so much going on because of the pandemic. So get some physical activity, lose some weight, take your medications until your A1C is lowered. And with your doctor's care, you can begin to reduce and get off your medications. I promise you, I have helped so many people get off their medication. And my husband, who lives with me, is a living witness that making those changes can help. So now, if you don't take care of your diabetes, here are some complications that can happen. You increase your risk of developing any type of cancer, especially breast cancer in women. That's as far as I'm going to go with that, because I don't want to get knocked off of Facebook. Depression. 1 in 4 patients have some symptoms of depression that you may want to treat. So if you have symptoms of depression because your blood sugars are going crazy, you're stressed because you're not managing it properly, you're taking the medications that may be causing some issues, go see about it, get treated, because you don't want that depression to sink in. Thank you, First Lady Jamerson. Thank you for being on today. I appreciate it. Yet you don't want your depression to start to sink in because you're having issues. That's what I do as a health coach. I help you talk through some of these. If you can't talk to me as a health coach, find you somebody that you can trust and have those good conversations with. You could start having some eye problems, blurry vision. People with diabetes have a higher risk of cataracts. People with diabetes have foot issues, poor circulation, and possible nerve damage can lead to foot problems. That's why people that have diabetes, your doctor will always look at your foot to make sure that you're circulating your blood is circulating through your foot, because that's what happens with diabetes. It causes circulatory problems, that your hands start tingling, you get tingling in your extremities, and that means your blood is not flowing the way it should. So if you're having tingling, numbness, that could be an issue. And did I say that? Yes, I think I did. If I didn't, I meant to. That could be a symptom of diabetes, and that can cause foot issues. That can cause blood issue, eye problems, because the blood is not flowing. You could have more, have heart issues or stroke. These are increased complications of the circulatory system. So if your blood is not circulating properly, then it could cause heart disease and a stroke. We don't want that. You can start having some kidney issues. Kidneys can become damaged, making them less able to filter out waste from the body. That's what our kidneys are. They filter waste and they get it out of your body through your urine. And so if your kidneys are damaged because of diabetes issues, you could start having some kidney issues. Now, diabetic neuropathy. That is a big one. The nerves become damaged. The nerves connect the spinal cord to the skin, to the muscles, to your blood vessels and other organs. Thank you, First Lady. I'm hoping that I'm saying things that resonate with people and that people know. Sometimes you just got to hear these things over and over again to make that light bulb go off and say, enough is enough. I need to do something, and I need to do it now. So diabetic neuropathy, like I said, the spinal cord, the nerves connect to the spinal cord, and that connects to your muscle, your blood vessels, and other organs in your body. It's one of the most common complications that people have from diabetes. And it's a progressive disorder that affects around 20% of people with diabetes. So that's why your doctor checks your feet. You don't want to be one of those 20% of people with diabetes that get diabetic neuropathy. Symptoms include tingling, prickling, weakness, and burning pain. You can prevent and treat neuropathy by eating a gluten-free diet and controlling your blood sugar. So let me talk a little bit about a gluten-free diet. Gluten is a protein, and you hear a lot about gluten-free. I do a lot of gluten-free just because gluten makes it messes with my stomach. I get all that bloatingness. And so if you're getting all that bloating and you feel lethargic and you just feel terrible after eating certain foods, you could have a gluten intolerance. And I could go to a whole spiel about what happens with how the wheat is grown these days. That's another conversation, but you could have a gluten intolerance. So gluten is a protein found in wheat, plant, and some other grains. So a lot of the wheat is grown with genetically modified foods. These are seeds that may come from a laboratory. They're not real seeds. And a lot of times the wheat that is grown, it's all the good stuff is stripped away. And what's left is what food manufacturers use to produce processed foods, because those processed foods can stay on the shelves longer. They don't grow rancid. And so the good stuff is taken away. The bad stuff is left. and that's what they use to produce a lot of our foods. So gluten is naturally occurring, but it can be extracted, concentrated, and added to food and other products to add protein, texture, and flavor. So a lot of times gluten was used to add flavor and texture in a lot of things. It's added in our condiments, and I mean just a lot of things. And so a lot of food manufacturers, because people are realizing that how gluten affects your body, a lot of food manufacturers now are saying gluten free. Now, you can do some research because a lot of products are naturally gluten free. And so the food manufacturers may charge you more just because it says gluten free. So find out what is actually a gluten-free product. Just buy it so you don't have to buy what labelers are saying are gluten-free. Am I making sense? Okay, perfect. It also works as a binding agent to hold processed foods together and give them their shape, like crackers and Cheetos and cakes. Even the breading that could be on your chicken nuggets that you give your kids. Things like that. You have to be careful. So, and I'm going to get a little technical here. It says humans have digestive enzymes that help break down food. So most of my clients, I tell them to take a digestive enzyme because our bodies have naturally have an issue with breaking down foods. But if you have a lot of gherkin junk in your food and a lot of gluten, your body is even worse trying to get rid of all that stuff. So protease is that enzyme that helps your body process proteins, but it can't completely break down gluten. So undigested gluten makes its way into your small intestine, and most people can handle the undigested gluten with no problem. But in some people, gluten can trigger a severe autoimmune response like celiac disease, but other may have unpleasant symptoms like bloating and gas and feeling lethargic and body ache. That may tell you that you might have a gluten sensitivity. So gluten in itself, especially gluten found in whole grains, is not bad for healthy people whose bodies can tolerate it. However, grains like wheat are often stripped down, like I said, to make processed food, such as crackers and snacks and chips. And these refined products have minimal resemblance of actual wheat. They've taken everything away. It's not even real food. That's where the problem is. And so that's what happens. All right, let me see where I am. I don't think I printed all my stuff. I think I printed some stuff. Okay, let me make sure I have everything. I think we're almost done. I printed some stuff, and I must didn't print everything. Let me make sure. Oh, I did. Cool beans. Wonderful. So we are almost done, but I just wanted to talk about diabetes because it affects so many people. And the thing is, you don't have to get it. I have this book here, and this is it's a book of vitamins and minerals, and I use this for when I do my hair tissue mineral analysis, because the hair analysis, it talks about what it will do is it will show you if you have some mineral imbalances in your body. And if you have diabetes, your body is already in a fight or flight. It's already fighting to stay healthy, fighting to control those blood sugars, which may cause mineral imbalances of a lot of different minerals, especially magnesium and copper and zinc. That's what comes up a lot on those analysis. And so we just want you to be minerally balanced, healthy, and strong. And so take care of your health. I have been preaching, and I will preach all through 2022. Take care of you in 2022. If you or a loved one has diabetes, we talk to this camera. If you or your loved one has diabetes, you can take care of it. You don't have to be sick. You can take care of your diabetes, and you don't have to. And you will see a turnaround quickly. I promise you. So, I'm doing a special, my hair tissue mineral analysis, which we take your hair, we send it to a laboratory, and it will tell us everything that's going on in your body. You will get a um, you will get a readout that's yours to take with you. And the thing is, you don't have to read this by yourself. I have my nurse, Leisha Ivy, and she helps to go over those results with you. And we will tell you what's going on in your body. If you have, and then also as a preventative tool, it will tell you if you've got something going on, that you may not know what's going on. For me, it told me that I was getting ready to have some issues with my heart, which was life changing because then I was able to do something. It told me that I had a lot of stress in my life. I'm like, me stress? I'm a pretty much chill person, I know, but I was having stress. So that's why I love the hair analysis, because it tells you what's going on in your body. So, and then with the hair analysis, you will also get 2 one-on-one coaching sessions with me. And that's all for $222. Normally I charge $135 just for a coaching session alone. But I want you to get well. I want you to take care of you in 2022. So whatever I have to do to help you to do that, that's what I'm willing to do. So I ran the special all of July. I'm running it for this last week for $222. I am going to go up on the price, $10, $232 after this week, and then it will go up gradually. But it's been popular. I've sold many of them, and we are turning around people's health, and that's what it's about. So I don't know if anybody has any questions. I hope you learned something from this. I know it helps me when I teach these sessions and help other people. But think about getting a hair analysis. I also take flex spinning account cards. So if you have a flexible spinning account, you can use that to pay for this as well too. Your doctor wants you to be well, I'm sure. He takes blood tests. You could even take this hair analysis to your doctor and say, this is what it was found. What do you think? How do you think it's going to affect me? So I think we're done. I don't know when I'll do another lunch and learn, maybe in the next couple of weeks. I believe the next one is going to be, what did I have here? I think I got rid of it. I forgot what I was going to do for the next one, but we will do another one on a Wednesday. Wednesday are a good day for me. And we'll do another lunch and learn on a topic. Maybe DM me, tell me what you would like to learn about. What is of interest of you? What are you struggling with? What are some of your greatest frustrations? And then I will tailor a class for you. But we've been on for about 37 minutes, much longer than I wanted to be. But I just wanted to, hopefully this was helpful. If you would like this handout, I will send it to you. And then you could go over it again. Everything I talked about is in this handout. And also I have a free download as well too. This is the free download. I've got too many things going on, but I have this download. If you want this, let me know. I will send it to you. I hope you learned something. Share if you are watching this on replay. Let me know. It's a snowy day or a terrible, nasty day here in Springfield, but I hope you stay warm, happy, and healthy. Take care. God bless. If you want to contact me, you can contact me. My number is 417-300-2796. My email is Melesha, MELESHA, @LOVE, 4lifewellness.com. Thank you, First Lady McGill. You have a blessed day. Thank you so much for being on. I hope this helps you and somebody you know. So email me, call me, text me, DM me. Let me know how I can help you. So have a blessed and wonderful day. Take care, and we'll see you next time. Melesha, Love for Life Wellness, where we are living the rest of your life as the best of your life. Take care of you in 2022.